I wanted to introduce our next speaker, who's Chloe Holmes, who is a new trustee for us, and she's going to talk about the youth engagement group that she's been involved with. So, Chloe, off you go.
So we've decided we'd do this as a question and answer session, take a bit of pressure off Chloe. So Chloe, thanks so much for coming to talk to us about the youth project. For those of you who don't know, I'm just going to give a bit of background to the project. So during COVID, we saw the numbers of young people accessing our youth service decline. That also coincided with the loss of our second youth worker. And we as an organisation are acutely aware that as we come through the pandemic, the needs of children and young people that we support are greater than ever before. So we have a big responsibility to help them feel less anxious, better connected, and to provide better support. So we commissioned an agency to find out really what children and young people wanted. It was important to us to feel that whatever we were looking forward to providing, that it was what actually they themselves felt would be best for support. So we commissioned an agency. That agency put together a project group of which Chloe was a member, and the project group was led by young people, and they created three young leaders, of which Chloe was one. And they helped shape those focus groups and really sat and heard what it was that children and young people want. And that has been the basis of us moving forward. And as Nick alluded to, kind of putting some money towards this project, but also putting in a lottery grant for a much bigger project. So Chloe, are you happy for me to ask you some questions about that project?
Yeah, absolutely.
Great. So my first question is, why did you want to become involved with the project?
Well, I've received support from the youth service now for like a year and a half, so I know how important the service is in helping like young people who are impacted by Huntington's, and so I thought if there was a way that I could be involved in helping the service to continue to develop, that I would, happily be involved in that. And I think as well, on a personal level, at the time of this project, I was at risk of Huntington's, so I couldn't control whether or not I'd inherited Huntington's, but I could become involved in the community or in this project to help give me a sense of control and a bit more of like positivity, I suppose, towards Huntington's. So that's also partly why I wanted to.
Thank you, Chloe. Real powerful reasons for being involved. What was your role as a young leader?
So alongside the agency, we co-designed 2 focus groups for 2 different age groups. So I think the first one was around 8 to 13, and then the second one might have been 14 to 18. So myself and the other young leaders, we spoke to the agency about our experiences surrounding Huntington's and what it meant to be like a young person impacted by the disease, so that they could understand, I suppose, as well, when they were designing the focus groups, what would be helpful to look at. So we supported with the co-design, and then we also co-facilitated the focus groups. So we had the opportunity to lead some of the sessions or some of the activities within the focus groups as well, which was really good.
Great, thank you. And did you feel that you were equipped for that role?
Yeah, I did. I think, well, I spoke to James beforehand, so he gave me like an overview of what the project would involve. And then when we met the agency members of staff for the first time, they explained what the project would involve. And during those co-design sessions, it was all made very clear what the focus groups, what the plan for the focus groups was, so that when we then co-facilitated those or supported with that, we knew like exactly what was going to happen. So it was very structured in terms of like the plan for the focus group. So I did feel prepared beforehand, and James was also like available like throughout the project as well if we had like any questions or anything, so that he could support us as young leaders too.
Great, thank you. And what did you gain personally from that experience, would you say?
I think it helped me in quite a few different ways. So I think I work as a therapist within the NHS, but at the time during COVID, I've not been able to run any groups for children that I work with due to the service. So by being able to support with like the co-facilitation of the focus groups, it's helped me to develop those skills that I should have been able to develop professionally, but I've not had the opportunity yet, just because since I've qualified there's been COVID. But I think it's also helped me to like change my view on Huntington's, I think, because to me it was always something that was really negative, and I really struggled to like see any like positives surrounding it. So I think that being involved, it's helped me to see that it's not all, or it doesn't all have to be really negative, like the positive things can come from it, because I stayed in contact with one of the other girls who was a young leader, and you know, we're friends now and we've done some fundraising together. So it doesn't all have to be like really negative, like a negative experience. That, you know, you can have positives, you know, like within the community. So
sounds like you gained a great deal from it, and have gone on to do some really good things with that and that knowledge. So that's brilliant. What would you like to see as a result of that project?
I think that one of the things that really stood out to me during the focus groups was within the older focus group. I remember one of the young people saying that this was the first time that they had the opportunity to speak to other people in a similar situation to them, who was like a similar age. And so I think that what I took from the focus group was that it was really important for young people to have connection to other young people. So I think that that's something that I would really like to see, like more opportunity for people to be able to share their experiences, or kind of have support from one another, or just like to meet up, whether that's like online or in person, just to talk. Or it doesn't even have to be focused around Huntington's all of the time. Like that was also quite important to have that balance. But that's what I would quite like to see to come from the project, that people have that opportunity to meet other people their own age, whether that's, you know, the younger age group or the older ones.
Great, thank you. And then my last question is, what's happened since that report was published?
So I know that one of the things in the report was that there was a need for more members of staff within the youth service, because it covers the whole of England and Wales. And I do know that the charity has just employed a new youth worker, which is really exciting. So hopefully that will help the service be able to reach more people. There's also now going to be like a development of a youth advisory board, which is coming up or is in motion at the moment. So that's really exciting, and there's the opportunity for young people between the ages of 14 and 25 to be able to get involved in this group. And what that means is that they'll be able to, I suppose, feedback to the charity what they need as young people who are impacted, and meet other people. So I think that that's really exciting, and I think my understanding is that there'll be some information shared on that within the next month or so to more members of the public, so that if you're between aged 14 and 25 and want to get involved, then you'll be able to find out more about that.
Great, thanks, Chloe. So there were all my questions, but I did just want to say a huge thank you both to yourself, but actually to all the children and young people who were involved with that project, because it's really helped us focus on how we need to move forward and how we can embed voices of children and young people into anything that we do moving forward, in any service we develop for them. So thank you so much, Chloe. Really appreciate everything you've done.